Ready? Hello, Dr. Potts. This is Courtney. I'm the nurse taking care of the patient in 284, Haley Schmidt.
Okay. Can you tell me a little more about her?
She was complaining of some pain in her calf, so I took a look at it, and it's pretty warm and red. She rates her pain about an 8 out of 10. Her vitals are all stable. She was like 127/84. Her respirations are like 16 a minute. Her pulse is about 84. And her temperature is like 99. I'm thinking it's probably a blood clot. I don't know if you want to possibly send her for an ultrasound, and if you can come up and take a look at it.
Well, I would like it if you'd send her down for an ultrasound, and when you get the results back, will you give me a call, and I'll be right up.
Okay, absolutely. Thank you so much.
Yep. Okay, Courtney, you want to show me what you're noticing here?
Hi, Haley.
Hi.
This is Dr. Potts. We're just going to come look at your calf.
Okay.
It's just been warm, and she said the pain, and it's pretty red.
Okay. Yeah, that is definitely...
It hurts really bad.
Okay. On a scale from 0 to 10, how would you rate it right
It's
now?
probably like an 8.
Okay. We definitely have a clot going on here. We don't move that. If you would just keep it stable. We don't want that clot to move, because if it moves, it could go to your lungs, and then we can have real problems. And if you have any shortness of breath, please make sure you let the nurse know. Okay, can I listen to your lungs now? And you take a deep breath in.
Yep.
And again. Good. Okay. Her lungs are clear right now, but I would like it if you just keep an eye on that, because if that moves, we need to take some drastic measures.
Absolutely.
Okay, and I see here on your history that you smoke and you've been taking birth control.
Yes.
How long have you been on the birth control and smoking?
I've been on the birth control 3 years and smoking for about 2.5.
And there's no chance of you quitting in the near future?
I've tried a couple times, but it hasn't worked out. So.
Okay, it might take 6 or 7 times, but we would really appreciate if you'd quit the smoking, because when you smoke and you're taking birth control, this is what causes these blood clots, and we don't want to have them.
Okay.
So what I'm going to do is I'm going to put you on a Pixaban, or Eliquis is also known as.
Okay.
I'm going to give you some information so you can take this home with you. But what I need you to do is take 5 milligrams twice a day, once in the morning, once at night. Please try to take that as close to 12 hours apart as you can, so that we can continue to have a nice level in your blood, if that's possible. Okay? And I'll have the nurse make sure that she goes over this again with you before you leave.
Okay.
We're going to keep an eye on that, and what I want you to know is if you have any change in your mental status whatsoever, if you have any major headaches, like the worst headache you've ever had, please get somebody or let somebody know that that's happened to you, because it could be an internal bleeding, and we don't need that. Okay. If you're brushing your teeth and you notice blood more than normal, let us know. If you get any unusual bruising, you go to the restroom, you notice any blood in your urine, any blood in your stool, anything like that, please let us know. What do you normally take when you're having any kind of pain, like a headache or any aches or pains? What do you normally take?
Motrin.
Okay, we need to change that, if you don't mind, if you would start taking acetaminophen, which is a Tylenol. The other would work with that, and then you'll have more risk of bleeding. We don't want any of that. Also, not take away this clot. It's just going to prevent any more from forming, and hopefully your body will just eventually take care of this on its own, and hopefully this will work for us. Okay, is there any questions on this?
I don't think so.
Okay, Courtney, if you wouldn't mind making sure you go over this before she leaves.
Absolutely.
And make sure you go over the side effects a little more with her, so that she's very aware, so that we don't have any problems. Okay?
Thanks so
It
much.
was nice seeing you. Have a good day.
Help! Somebody help!
What's going on in here?
She cut her hand. I applied pressure. I can't get the bleeding to stop. She's on Eliquis.
Okay, nurse, I need you to get an IV started with normal saline.
Be right on that.
Hurts so bad.
Keep applying pressure.
I'm so scared. It's gonna happen.
It's okay. Haley, we're going to take good care of you. We'll get this bleeding stopped as
Okay,
soon as
Haley,
we
can I
can.
have your hand here? Okay.
I immediately do not take
We're
this
just gonna
Eliquis
start
anymore.
an IV here.
We'll get you onto something else.
Okay, you're gonna feel a little pinch, okay?
Is the bleeding almost?
scared I might pass out.
We're applying pressure, Haley. We'll get it stopped, okay?
Okay. Ow.
All right.
Is it slowing down any now that we've got this going?
Yep, it is.
Eliquis is indicated to reduce the risk of stroke and systemic embolism in patients with non-valvular atrial fibrillation. Eliquis can also be used to treat or for the prophylaxis of deep vein thrombosis, pulmonary embolism, and to reduce the risk of recurrent DVT or PE following initial therapy. Eliquis inhibits factor Xa and thereby decreases thrombin and clot formation. Eliquis is contraindicated in patients with active pathological bleeding or severe hypersensitivity reaction to Eliquis. Eliquis can cause an increased risk of thrombic events after premature discontinuation. Premature discontinuation of any oral anticoagulant, including Eliquis, increases the risk of bleeding and can cause serious, potentially fatal bleeding. The use of other drugs affecting homeostasis increases the risk of bleeding, including aspirin, other antiplatelet agents, and other anticoagulants, such as heparin and other thrombolytic agents, SSRIs, and NSAIDs. The most common and serious adverse reactions reported with Eliquis were related to bleeding. Eliquis is likely to increase the risk of hemorrhage during pregnancy and delivery. Eliquis should only be used if the potential benefit outweighs the potential risk to the mother and fetus during pregnancy.
It is.
Okay, good.
I don't think it's that fast, but we'll run with it.
Are we done?
And I have to cut that out.
Okay.